Hello, everyone, and welcome to today's webinar, The Keys to Kidney Health. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You've joined the presentation listening with your computer's speaker system by default. If you'd prefer to join over the telephone, select the arrow next to the mute/unmute icon on the bottom of your screen in the Zoom toolbar. Select Switch to Phone Audio, and then select Phone Call and follow the prompt to dial in. By default, all participants enter the webinar with audio muted. For those of you joining on your computer, you'll have the opportunity to submit text questions to the presenters by typing them into the question and answer pane found in the Zoom toolbar at the bottom of the meeting window. Please avoid using the chat box to submit your questions. It helps us to monitor them more effectively when they are all submitted within the Q&A pane. You may send your questions in at any time during the presentation. We will collect these and address them during the Q&A session at the end of the presentation. In order to protect your privacy, when you ask a question, please do not use your name or provide any other personal identifying information. Today's webinar is being recorded, and you'll receive a follow-up email at the end of you'll receive a follow-up email within 48 to 72 hours with a link for on-demand viewing. I'd like to introduce our moderator for this webinar, Lydia Lauder, National Director of Programs and Public Policy at the Kidney Foundation. Lydia?
Thank you very much, Janice, and welcome everybody to today's webinar. The Kidney Foundation of Canada would like to thank our sponsors for making the 2020 Kidney Foundation webinar series possible: Alexion, AstraZeneca, Horizon, Janssen, Otsuka, and Paladin. It's now my great pleasure to introduce our speakers for today. Our first speaker is Dr. Joanne Kappel, who is a clinical professor of medicine, provincial medical lead for kidney health, and medical director of the Chronic Kidney Disease Program, Saskatoon, with the Saskatchewan Health Authority. She also holds the chair of the National Programs and Public Policy Committee and is the Saskatchewan Branch Medical Advisor for the Kidney Foundation of Canada. Dr. Kappel is also the co-chair of the Knowledge Translation Committee for the CanSolve CKD network. Dr. Scott Clarenbach is a professor in the Department of Medicine and Assistant Dean, Health Outcomes at the University of Alberta. His research interests include health outcomes and health economics research. He's conducted numerous economic evaluations and health technology assessments for both chronic and acute conditions. He holds the Kidney Health Research Chair at the University of Alberta. He's currently chair of the Alberta Expert Committee on Drug Evaluation and Therapeutics and member of the Canadian Task Force on Preventative Healthcare. Welcome to our webinar on the keys to kidney health. The kidneys are really extraordinary organs. They do most of their work silently, and it's only when people lose about 70% of their kidney function that people see any symptoms. There are many people in Canada who have got chronic kidney disease, but many of them don't know about it, so they're not able to take the steps to protect their remaining kidney function. If you have reduced kidney function or in the early stages of CKD, this webinar should be helpful for you and your family. By using the information in this webinar and working with your healthcare team, you will learn how to manage your kidney disease. This webinar will have information about your kidneys, how they work, the stages of CKD, and steps that you can take to help you protect your remaining kidney function and maintain a healthy lifestyle. Please also note that we are unable to provide medical advice for specific issues.
So your kidneys are really very sophisticated trash collectors and treatment plants. They're slightly larger than your fist, and they're bean-shaped, hence the name kidney beans. They're located near the middle of your back, just below your rib cage. So they're not on top of your hip bones, but much higher up on your back. So how do the kidneys work? Next slide, please. So every minute, about 1 liter of blood is pumped through the kidneys, and every minute, the kidneys do a multitude of jobs. First job is they remove waste products. One of those waste products is called creatinine, and that's how we measure kidney function. The second job is to remove excess water or to retain water if the body needs it. The third function is to regulate your blood pressure. The fourth function is to ensure safe levels of sodium or salt, potassium, which is another electrolyte that helps your muscles work, calcium and phosphorus, both minerals that help your teeth, bones, and your immune system. And the final job of the kidneys is to produce a hormone called erythropoietin to help your body make red blood cells. So when the kidneys are not working as well as they should, they do not make enough of this hormone called erythropoietin, and therefore your blood is low or you may be anemic, and that can cause symptoms like fatigue and tiredness and coldness. Next slide, please. There are various stages of chronic kidney disease, ranging from mild loss of kidney function to complete kidney failure, or what we call end-stage kidney disease, which is stage 5. Not all chronic kidney disease conditions progress to kidney failure. Most people fall into the mild to moderate stage, so mild being stage 2 to stage 3B. Kidney disease is measured using a blood test, which is used to calculate how the kidney is working, and a urine test to show how much albumin or protein is in the urine. So 2 tests are required in order to measure your kidney function, a blood test and a urine test. Calculation of the kidney function is called the GFR, or glomerular filtration rate. And this is a measure of how much blood in milliliters is cleaned by the kidney in 1 minute. So a normal GFR is 100 mils per minute, give or take, for a standard body size. The urine test is called an albumin creatinine ratio, or ACR. And that looks for signs that protein is leaking into the urine, and that protein in the urine is an important sign of kidney damage. Next slide, please. So in this slide here, which we call a heat map, the stages of kidney disease are mentioned on your left-hand side of the slide, and the protein is on the top part of the slide. So the stages of kidney disease take into account both the GFR, which is the blood test and calculation of your kidney function, and the ACR, which is the protein in the urine. So if your GFR is 40 mils per minute and your ACR is 30 milligrams per millimole, so 40 mils per minute and 30 milligram per millimole, you are at stage 3B. That is what your healthcare provider would be giving you. The green boxes in this slide represent normal. The yellow boxes represent a low risk for chronic kidney disease to progress to end-stage kidney disease. The orange boxes represent a moderate risk for chronic kidney disease to progress to end-stage kidney disease. The red boxes represent the highest risk. So one of our goals then is to help protect kidney function, is to try to decrease the protein or the albumin creatinine ratio in the urine. And Dr. Klarenbach will discuss steps to help protect your kidney function in a minute. Next slide. So how do you know if you have any risk factors for chronic kidney disease? Well, you can do the risk factor assessment at kidney.ca, the website, and the web link is at the bottom of this slide and will be put into the chat box or the Q&A. So some of the risk factors for chronic kidney disease are diabetes being the number one risk factor, high blood pressure being number two risk factor. But smoking is also a risk factor for chronic kidney disease. In fact, people who smoke are 3 to 4 times more likely to have chronic kidney disease than others. If you have a family history of kidney disease, you are more likely to have kidney disease yourself. And if you are of Indigenous, African, Asian, or Hispanic descent, by virtue of your ethnicity, you have a higher risk of chronic kidney disease, often through the mechanism of diabetes or high blood pressure. If you as an individual have any history of a heart attack or angina or chest pain, or have had a stroke or a mini stroke, or have had high cholesterol or gangrene or a limb amputation, even if it's of your little toe, you are at higher risk of developing chronic kidney disease. I would strongly advise all of you on this webinar to take the risk assessment at kidney.ca. It's 10 questions, 10 minutes, but you learn a lot. Thank you. Over to you, Scott.
Great, thanks very much. I'm going to go on to the next part of this talk, and we'll talk about a few of the steps that in general can help you protect your kidney function if you're at risk for kidney disease or if you have established kidney disease. Now, before I go into the details, I should just let everyone know that these are some of the general factors that are related to kidney disease and kidney progression. Some of you may have friends or family members or yourselves have very specific kidney diseases, in which case these still apply, but there may be other factors that you need to be aware of. So these are very general. They apply to a large proportion of patients who have kidney disease or at risk of kidney disease. And the first one I'm going to talk about, which hopefully many of you are well aware of, is blood pressure. So blood pressure is one of the most important factors of preventing or slowing the progression of kidney disease. And there's a bit of a vicious cycle with high blood pressure. When you get a bit of kidney damage, your kidneys tend to hold on to a bit of salt water, which then has a feedback loop causing your blood pressure to go higher. So you can see if that continues, your blood pressure can be very high, leading to ongoing kidney damage. Both for kidney health as well as general health, you should have your blood pressure checked. The target blood pressure for people in general is 130/80, but this can be lower in people who have kidney disease and certain specific types of kidney disease. So you should always ask your primary care provider what your goal blood pressure should be. There are different ways to measure your blood pressure. Oftentimes they get measured in your care provider's office. One of the best ways to measure your blood pressure and ways that you can take ownership and control over your blood pressure is if you have a blood pressure cuff at home. We're not really worried about blood pressure readings when you're really stressed or you're anxious or you've been running around doing chores around the house. The blood pressure that we care about is when you're sitting calmly and relaxed for at least 5 minutes. You take several readings with your arm at the level of your heart, and you only write down the last blood pressure reading. If you are at risk of high blood pressure or you're concerned about it, I strongly encourage you to think about or ask about getting a home blood pressure cuff so you can measure your values at home, then write them down, and when you see your care provider, they can take a look at the blood pressure readings and see if further adjustments can be made. I sometimes see some people in my clinic who get really worried because they had one blood pressure reading that was high, and then it causes a lot of anxiety and they're almost afraid to measure your blood pressure. But just to remember why we're looking at this number. We're not looking at one number, we're looking at what the average number is over months or even years. Keeping that number lower, both the top and lower number lower, is a good way to protect both your kidneys as well as other organs in your body such as your heart and the blood vessels in your brain. Next slide. This next slide is related to blood pressure and has to do with salt. Whenever you have salt, that means you have more salt water in your body. If you have more salt water in your body, as you can imagine, it will just push open your blood vessels and your blood pressure will be higher. Some people have too much salt in their body. It will be very difficult to control their blood pressure with medications or with exercise or with other activities. Furthermore, if you have any kidney damage, sometimes your kidneys don't get rid of salt as well as they should have. You might have remembered in that last slide, I mentioned that in some circumstances, when you have damage to your kidney, that can cause high blood pressure. That high blood pressure can cause further damage to your kidney. This is one of the ways where that cycle occurs, is by your body hanging and your kidneys hanging on to extra salt water. We also know that living in Canada and North America, that there is way more salt in our diet than is healthy. Most of that extra salt comes in from prepared foods or packaged foods. And sometimes it comes in foods that you wouldn't even know has a lot of salt in it. It's pretty obvious to most people that a bag of chips has a lot of salt. But sometimes you might not realize that if you buy a muffin from the store or from Starbucks, that can have as much or more salt than a bag of chips does. You just can't taste it. The recommendations are that the ideal sodium intake is 1,500 milligrams a day or less. But a very practical approach is cook your own food at home. When you're cooking your food, don't add salt. At the table, don't add extra salt to your foods. And then stay away from those prepared foods and eating out. It's the prepared foods and eating out that accounts for over 60 or 70% of the salt intake per day. And even the foods that you might buy from the grocery store that say low sodium on them still may have way more salt than if you were to make your own food at home. There can be ways to get rid of extra salt water in your body by using certain types of medications, either called water pills or diuretics. So if you tend to accumulate a lot of salt water, your care provider may ask you to take those pills. Next slide. One other factor that's related to the health of the kidneys, and again, this might be specific to some people in the audience, but not everyone, is diabetes. However, kind of some of the approaches to prevent from developing high blood glucose levels, or what we call metabolic syndrome, can be done by the same sort of factors that contribute to diabetes. So some of the general things are to watch your weight, get regular exercise, avoid high glycemic index foods such as sugary foods and breads. So the exercise, diet, and cardiovascular, taking care of your cardiovascular health can prevent you from developing diabetes. If you do have diabetes, you should be talking to your care provider, getting tested for your blood sugar levels. This can be measured in a number of different ways, from hemoglobin A1C or by the tests of your fingertip that measure your blood glucose. There are several different dietary mechanisms as well as medications or insulin that can be used to lower your blood sugar levels. Having really good control of your diabetes is one really great way to either prevent or slow the progression of kidney disease that's due to diabetes. Now, you might be wondering, why are we talking about diabetes when we're talking about kidney disease? And this is because of how common diabetes is, and because of the tight association with diabetes and diabetes affecting the kidney. Diabetes is one of the most common causes of kidney failure and of people needing to start dialysis. So using strategies to either prevent diabetes from occurring or from managing your diabetes really carefully once you have it are good ways to prevent kidney disease associated with it. Next slide. As Joanne mentioned before, smoking and or vaping, although the evidence is less clear on vaping, but certainly smoking is one of the major risk factors for development of kidney disease and progression of kidney disease. But it doesn't just affect your kidneys, as I'm sure you've heard from other sources, from your healthcare providers or even from the general media, that smoking can cause real damage to your heart and your lungs and your blood vessels of your body. In fact, if you do have kidney disease, stopping smoking can be one of the most important things you can do to keep your kidneys healthy. Saying this, smoking is very addictive, and it's really hard to stop smoking. There are several different strategies that can be used to help people to stop smoking. Seeing your pharmacist or talking to your primary care provider can help you develop strategies or find a way to quit smoking. And there are several websites online, and there's one that we have listed here, smokershelp.ca, that can help you stop smoking if you're a current smoker. Next slide. This is a very general suggestion, but activity can be really important for both your kidney health as well as your overall health. As mentioned before, being active and staying at a healthy weight can prevent obesity as well as the metabolic syndrome and diabetes, but it's also very good for your blood pressure. Staying active is also it can improve your blood pressure, blood sugar, might lead to maintaining your weight so it doesn't increase further, and can lead to overall improvement in your mental health and physical well-being. These activities don't need to be onerous. We're asking people to do things that are, extraordinary, or, even going to the gym every day or training to do a marathon. That's not what we're talking about here. We're talking about kind of regular things that you can integrate into your lifestyle on a regular basis. Finding things that you enjoy, like going out for walks, walking in the mall, finding things that you like with other people can really help develop habits of physical activity that can lead to all sorts of both mental health and physical health improvements. Next slide. If you're doing all the right things in terms of controlling your blood pressure, watching your diabetes, getting activity, eating right, avoiding salt, but there are some certain medications that can damage the kidney. One of the most common over-the-counter medications that can damage the kidney are anti-inflammatory medications, frequently called non-steroidal anti-inflammatory medications, or NSAIDs. These are things like ibuprofen, Advil, naproxen, and Motrin that have anti-inflammatory properties. And if you take them regularly and take them on a regular basis, they can be very harmful to your kidneys. They're more harmful if you have more extreme levels of damage to your kidney. If you have pain, taking medications such as acetaminophen or Tylenol can be really useful and can be quite beneficial for things like osteoarthritis. There are some circumstances where ibuprofen or Advil or the anti-inflammatories might be useful if you take them for very short durations under the guidance of a care provider, depending on your level of kidney function. But these should be always taken with caution, and we advise you to talk to your pharmacist or your primary care providers before you take them. There are other types of herbal supplements that might have medications or active ingredients in them that can be damaging to your kidneys. These are something else that you should check out with your pharmacist or care providers to make sure they're okay for you to take. If you're eating a healthy diet in accordance with the Canada Food Guide, Many people don't require a whole lot of additional supplements to keep themselves healthy. So keep this in mind. The other thing I caution people on is, while if you find some supplements that are safe to take and you feel better on them, there's no problem using them, many times there's not a lot of evidence that they actually provide any benefits, especially for people with kidney disease. If there was good evidence behind them and we knew about them, these would be things that we'd be asking all of our patients to take. So just be cautious about that. Always check, if you're in doubt, always check with your pharmacist or primary care provider. One other thing I'm going to note is that I talked about the importance of blood pressure. Sometimes people will be on blood pressure pills. They'll also be on water pills to get rid of extra salt water. But sometimes people can get really sick due to other causes. You might get a flu or a gastric bug. You might not be able to eat or drink. You might have a lot of diarrhea or vomiting. And in these circumstances, people can get dehydrated, especially if you continue to take medications that lead to loss of salt water. Dehydration and low blood pressure can be dangerous as well. So if you start feeling yourself getting sick, you're unable to take in food and water, you have a lot of diarrhea or nausea and vomiting, and particularly if you're on medications such as blood pressure pills or water pills, you should see your family doctor sooner rather than later or get advice. Continuing to take your medications that lower your blood pressure and get rid of salt water while you're sick and getting dehydrated can also be damaging to your kidneys and can make you quite sick. So some people call this the sick day regimen. These medications are really useful most of the time, but if you get sick or dehydrated, you may need to temporarily stop these medications until you're feeling better again. So again, check with your pharmacist or primary care provider in these circumstances. I'll go to the next slide. One other thing to note is there can be some special tests that might be ordered. One of the things that we do note about is a special test called dye tests. Sometimes these tests are really important and are needed to be done for other healthcare conditions, but tests often have harms as well as benefits. If you have kidney disease or you're at risk of kidney disease, these dye tests can cause damage to the kidney. One of the common ones is angiograms, where dye is injected into the blood vessels of the heart or the arteries of the heart, and that can cause damage to your kidneys. If you're being scheduled for one of these tests, or your heart doctor or your family doctor is talking about it, you should discuss the impact to your kidney with your primary care provider. Sometimes other types of dye, such as intravenous dye, can cause kidney damage as well. While sometimes these tests may be needed, there may be ways that you can lower the risk of these tests to your kidneys. So having adequate preparation, including making sure you're well hydrated, can protect the kidneys if you need these dye tests done. So again, the important part is to be aware that these tests might have an impact in your kidneys, and to have a discussion with your doctors to ensure the risk and benefit is favorable to you, and that you've done everything that you can to prevent any damage to them. All right, that's it for my section, and I'll pass it back to Dr. Capel.
Thanks, Scott. So what are the tests that you need again? So if you know that you are at risk for chronic kidney disease and you have done the kidney assessment on the Kidney Foundation website and you find that you have a risk factor for kidney disease, what are the tests that are needed? Well, you need that blood test to test for serum creatinine, and then that serum creatinine is put into a mathematical equation and a calculation of your kidney function, or GFR, is done. You also need a urine test, a spot urine test that's tested for blood and protein. And this spot urine test for protein is called albumin creatinine ratio, or ACR. So together, the blood test for GFR and the urine test for ACR can help your physician or your nurse practitioner determine what stage of kidney disease you may be at. And of course, your blood pressure should always be regularly checked. As Dr. Clarenbach has mentioned, blood pressure is an important treatment. Treatment of your blood pressure is very important in order to slow progression of your chronic kidney disease. So those are the tests that you need. They're not difficult to get. Next slide, please. So I think our take-home point is that exercise, modest exercise, eating healthy, not smoking, and having a healthy weight as much as you can are important for keeping your kidneys and your body healthy and happy. With that, I'll pass it over to Lydia.
Thank you very much, Drs. Kappel and Clarenbach. So now we are going to move into the question component of this webinar. And it's a reminder to submit your questions for the presenters by typing them into the Q&A box rather than the chat box. And this can be found at the Zoom toolbar at the bottom of the meeting window. Please note that we are unable to provide medical advice for specific issues as part of this webinar. So we'll start off with some of the questions that have come through to us during the webinar. So our first question is intense aerobic and anaerobic activity beneficial or detrimental if one has PKD? What max duration? Is dehydration an issue? I'm asking this because I'm an avid cyclist.
So I'll start, and Scott, please jump in. So cycling is an excellent exercise, and I think that avid cycling is fine, even if you have polycystic kidney disease. I think the question becomes is during your cycling, are you making sure that you are drinking enough water to replace the sweat and the water that you're losing because you're cycling so much. Is it detrimental to your polycystic kidney disease? Not likely, unless you fall off off the bike and damage yourself. But cycling is a wonderful form of exercise, and I would encourage you to continue to do that. Anything else to add, Scott?
No, I was going to say I'm an avid cyclist myself, so I think that's fantastic. And some of the suggestions might differ depending on your level of kidney function. So I totally agree with Joanne. Exercise is great. If you're really pushing things, though, you might want to spend some time talking to your kidney doctor, your primary care provider, just to make sure you're not going too far in the red or not stressing yourself too much. But if you kind of pay attention and use common sense and not push too hard, I think it's a fantastic activity.
Thank you very much. Moving on to our next question, we've had a question about long-term use of anti-rejection medications, and it's just a generic, how about long-term use of anti-rejection medications? So I would open that up to both doctors to comment on that.
I was going to, we both kind of started at the same time. I might defer this question. I'm not sure exactly what it refers to, but if you've had a transplant, an organ transplant, and you need those medications to prevent rejection, then that's a very specialized scenario that would be difficult to give really general advice on. That's one that you should see your transplant specialist and or your kidney specialist to discuss. There'd be trade-offs and pros and cons. Yeah.
Yeah.
Sorry.
Absolutely agree. Yeah.
Okay, thank you very much. Now we have had a question from a dialysis patient, and her question is, why would my blood pressure be low all the time, approximately 99/63?
Well, I think that depends on your specific situation. Your blood pressure may be low because that's your blood pressure. But your blood pressure may be low if you're also on medications that lower your blood pressure. At the same time, they're trying to take off fluid when you're on hemodialysis. Sometimes if your heart function is not as good as it could be, sometimes people's blood pressure may be lower as well. Again, I think this is a discussion that you should have with your nephrologist in the dialysis unit, or with the nurse coordinator in the dialysis unit, to ask them that question specifically in your case. Scott?
Yeah, and just to know, we have a lot of good evidence that if you have chronic kidney disease, having a lower blood pressure is better. We have less evidence of what the optimal blood pressure is for people on dialysis. And people on dialysis, it can be various factors like what your heart function is, etc. So I'd agree, there might be many different reasons why blood pressure can be low. And it's probably not a general answer to give you, unfortunately. So again, I would reiterate the importance of talking to your doctors or the nurse practitioner about why your blood pressure might be low.
Okay, thank you very much. Next question is, if your blood work shows your sodium as below normal, does that indicate you manage your salt intake?
No, and that's a tricky part. The sodium concentration in your blood is a measure of how much sodium compared to how much water. And often it's a reflection of what the water part is doing. How much total salt is in your body, sometimes it's a little bit tricky to figure out, but it's often we see the results by if you notice a bit of swelling in your legs and you can stick a finger in it and it gives a little bit divot. Some other signals that you have too much salt water in your body is shortness of breath, especially when you're lying flat. So those are the kind of things we're talking about for salt intake. Your sodium levels or sodium concentration is a different measurement. And again, a little bit unrelated to how much salt you're taking in, but that's a kind of I guess a separate scenario that you should probably talk with your primary care doctors with.
Right. I like to tell my patients when they ask me that question about, well, my salt level is low, so I must be doing okay. Well, the salt and water go together. They're sort of like married to each other. So mostly a low salt level or a low sodium in your blood test is usually a sign that you have too much water in your body.
Okay, thank you very much. Our next question is, my friend has polycystic kidney disease. Does the paleo diet really help? And what about taking beta hydroxybutyrate? Will this help slow down the disease?
So a paleo diet, I don't even know what a paleo diet is. So I confess my ignorance about that. Although I can tell you that a plant-based diet, there has been some evidence that a plant-based diet more than an animal-based diet does slow progression of chronic kidney disease, not just polycystic kidney disease, but chronic kidney disease in general. Beta hydroxybutyrate, I have no experience with that, so I'm sorry that I can't answer that question. Scott, do you have anything to add?
No, and I'm a little bit wary of fad diets, especially keto diets, where you go into a state of starvation. Saying that, living in North America, we have way more calories and a lot more unhealthy foods. So eating more, depending on your kidney function, but eating less processed foods and salty foods and more fruits and vegetables is generally a good approach. I'm not aware of really specific evidence in polycystic kidney disease. Any specific diets that someone is thinking to go on, especially if they have more advanced kidney disease, they should be speaking to their dietitian about to make sure it's safe for them and it's healthy.
Okay, thank you very much. Our next question is, firstly, a comment. Hello, thank you for this opportunity to learn about CKD. the question is about home blood pressure monitors. They have a wrist blood pressure monitor, and this person's specialist thinks the wrist ones are not that accurate. The question is, what are your thoughts on this matter?
Yeah, I have, sorry, go ahead.
My thought is I agree with that individual's specialist that the wrist monitors are not as accurate as the monitors that are on the upper arm. Having said that, sometimes people can't find the right size of blood pressure for their upper arm, and therefore a good surrogate or a substitution would be a wrist monitor, but generally they're not as accurate.
I have a colleague who's really interested in blood pressure, and my understanding is the same, is that while there have been advances, they may not quite be as accurate as the arm cuff. One other thing to note is that you don't need to be measuring your blood pressure all the time. So once you're at a target, what some of the recommendations are is, you know, once a month or once every 2 months, you pick 2 or 3 days, you measure your blood pressure maybe 3 or 4 times a day for those 2 or 3 days, and you write all those numbers down. Then the rest of the time, you don't need to worry about it. Only if you're kind of making changes to your blood pressure medications, or if you're noticing it's high or low, you might need to do it more frequently. But for regular monitoring, there's not a lot of advantage to measuring it every day, several times a day. So I think some people are more interested in the wrist ones because they seem to be more convenient. But if your blood pressure is well controlled, and, you know, once or twice a month you spend those couple days to measure it and everything looks good, that should be a minimal inconvenience for you.
Okay, thank you very much. Now we've got a question about someone's sodium level is chronically below normal. They have an ileostomy with a fairly high output, and they're trying to manage their sodium intake. They take baking soda daily, and I think they're reaching out for some tips on this sodium level being chronically below normal.
So the sodium level is chronically low in that situation is because you're losing a lot of salts and water from the ileostomy. So in that case, and you're also losing something called bicarbonate from the ileostomy. And so that's partly why you're on baking soda, is it's providing sodium, but it's also providing bicarbonate. And in your situation, and again, you need to speak with your primary care practitioner or your nephrologist if you have kidney disease. People who have an ileostomy and have a lot of ileostomy losses really should probably not be on a sodium restriction, that they do need to actually eat more salt than what other people need to eat. But again, yeah, as an individual, you may have other things that we're not aware of, and you should be speaking with your primary care physician or your nephrologist to ask pointed questions for your case.
Okay, thank you. Very good advice there. Thank you. Now, the next question is, where can we see that chart again on CFD or CKD classification? I might just start, if I may, and that is that the slides will be made available together with the recording of this webinar within 24 to 48 hours. And so you'll be able to replay and see those slides again. However, Dr. Capel or Dr. Clarenbach may be able to identify if there's some other resources they're aware of where they can find that classification chart.
That classification chart can be actually found on the web, and you just have to do kdigo.org, or you can Google the CKD stages chart, and that will come up as well. Scott, do you have an easier way of finding that?
No, I was just looking at that. I was just trying to see if they had any patient-specific resources, because a lot of the information on the KDIGO, which is it's an organization, a national organization that they have all the experts come together, and they kind of come up with consensus guidelines on, you know, evaluating and managing chronic kidney disease. However, so if you're interested, take a look at that website. Kidney Disease Improving Global Outcomes, or KDIGO. Some of it, you'll see that chart, but it can be a little bit complicated. I don't think there is a patient-specific tools, but that's where the Kidney Foundation website might be really valuable to simplify some of that information.
There is a simplified version of that chart available in our patient resources on kidney.ca as well. Yeah.
Great. That might be better for people to access. Yeah.
Thank you. Our next question is, I have PKD and it hurts when I run, but I love to run. Do I need to stop?
Tough one. I mean, there can be various reasons why people have pain. They could have stones or because of the cysts or just the large size of the kidneys. I would be hesitant to give an answer to that question without knowing your medical history. So that's something you should check out with your care providers. If it's just discomfort because of the large size of the kidneys and you're willing to put up with it, that might not be a major concern. But if it's other issues that might be affecting the kidney function or other factors that your doctors identify, then you might need to be a little bit more careful with it.
Yeah, agreed.
Thank you very much. Next question. My red blood cells, hemoglobin, platelets are all low. Is this to do with CKD?
The short answer to that is likely no. The kidney produces this hormone called erythropoietin, which helps your bone marrow make red blood cells. But the kidney has nothing to do with your platelet count and has nothing to do with your white blood cell count.
Thank you very much. Our next question is about research. Can you kindly inform us if there is any research being undertaken for developing any medicine or innovation to reduce the creatinine level or cure kidney disease? It also appears the existing dialysis is the same as it has been for the last 30 years.
Those are some great comments. There is research. One of the confusing things or complicated things is we talk about chronic kidney disease, but really that comprises a whole number of different types of disorders. So for example, in the last couple of years, there's been the advent of new medications for diabetes that look like they slow the progression of diabetic kidney disease and reduce the risk of needing dialysis. So some of these, and there's other treatments and other types like glomerulonephritis. Again, these are all separate topics where there's been advancements in treatment. But you're right, there's still lots of work to be done. The kidney is a really complex organ made up of millions of filters. And often once that damage is done and the scarring occurs to the kidney, there's no way to reverse that or to kind of create new kidneys. As far as dialysis, you're right. I mean, it's not entirely fair. I think there have been some advances in dialysis, but especially the home-based dialysis therapies. There's a lot of research going on wearable dialysis, miniaturizing it. None of those are ready for prime time yet, however, but there is a lot of work being done. And there's also increasing work being done in the transplantation field. So increasing the number of organs available for transplantation, and doing a better job of making sure those transplanted kidneys stay healthy. But you're right, we have a lot of work to do, and that's why the Kidney Foundation is still a strong supporter of research. I should maybe acknowledge my bias. I'm a researcher as well, so we have lots of work to be done. But there have been some advances, and there's lots of people in Canada and internationally who continue to work on some of the problems that you outlined.
That's right. And so if people want to go, they should go to the Kidney Foundation website and check on the tab research, and they'll find some excellent summaries of what's really happening in the research world or in research in Canada. So I'd encourage you to go there to look at that. And just as an aside, I've been a nephrologist for a long time, and there has been changes in dialysis. At one time, a dialysis bath that you now actually don't even see was mixed up in a great big vat that then was supplied to the machines. When I started my career, erythropoietin, the shot to help you make red blood cells was not around. And so lots of things have happened. Have we cured kidney disease? No, not yet, but I think that that's something that we should aspire to.
Thank you very much. And I'm also showing my age. I have seen quite a lot of advances in the dialysis as well, and some of the medications in my time as well. Now, the next question goes back to salt, so I might start with Dr. Clarenbach with this question. Is a salt alternative such as no salt safe, or should I just limit the amount of sodium I have altogether?
So first I'm going to plug the resources of the Kidney Foundation. The Kidney Kitchen is a fantastic resource. There's lots of information there from dietitians, created by dietitians who know a lot about kidney disease. So I'd encourage anyone who has questions about diet, especially salt, to go to that webpage. One of the problems with some of the non-sodium salt alternatives is they can have other things in them that give them their flavor that can, in some circumstances, be detrimental or dangerous in people, especially if they have advanced levels of kidney disease. So things like potassium, for example. When I talk to the dietitians, they say that the safest thing to do is to stay away from those of salt or salt alternatives and stick with some things like other spices, hot sauces, or herbs that don't have salt or kind of the no salt flavors to them as a way to making your food quite tasty and avoiding those things like salt or extra potassium. The one thing to note, and Joanne, I don't know if you have comments on this as well, but I have a lot of patients and I've had many patients who find it a real struggle at the beginning to move from a normal, like kind of our normal diet, which is high in salt, to a low salt diet. But then once they've made that transition, their taste changes.
Yes.
And then when they eat kind of normal foods, they say, whoa, this is way too salty. So the other thing I encourage people is, stick with it. If you stick with it, then your taste will adapt and you'll find the diet tastes great.
Yeah, no, and that's absolutely true. Yeah, absolutely true. And the other thing I'd like to mention about salt substitutes. So salt substitutes are generally potassium chloride. And so if you have a problem with your potassium level already, using a salt substitute like potassium chloride could actually be quite dangerous for you. So, so try to use things like spices and that type of thing. And I'd like to emphasize what Scott has said. Kidney Community Kitchen is absolutely fabulous. I've used recipes on there and I love them.
I'm actually cooking a recipe from there tonight. So yes, it's there's some very flavorful recipes out there, but don't use the salt, and really you've got no chance to experiment and try something new there for sure. Next question was, can you reverse kidney damage? For example, can you make your GFR go back up and lower your creatinine?
Depends.
Mm-hmm. Yeah.
It depends on a certain circumstance. It depends why your GFR dropped, what the factors are. In general, once you have chronic kidney disease that's well established, those little filters are often scarred and they don't recover. If there's only temporary damage to them due to various factors that can occur, sometimes they can improve. In general, when most of the patients that I see in our chronic kidney disease patients in the clinic with chronic kidney disease, the goal is to maintain their level of kidney function or slow its progression. Again, you'll have to speak to your doctors to figure out which category you might fall into.
Okay, thank you very much. Now we have a question about the effects of tea and coffee and dietary issues for CKD.
So, well, tea and coffee, particularly caffeinated tea and coffee, can increase your blood pressure. But that's if you're drinking a lot of tea and coffee. Now, what is a lot? I guess it depends upon your individual take on it. But people are generally drinking more than 5 to 6 cups a day, and may have some difficulty with their blood pressure. And that's one of the reasons why we advocate when you come to the office that you should not have had a tea or coffee at least for an hour prior to you seeing the physician, because that will make your blood pressure go up. The other issue about tea and coffee is that they sometimes can act like a diuretic or like a water pill. And so you tend to then go to the bathroom more. And then if you're not drinking more fluids, then you can become somewhat dehydrated with that too. But other than that, tea and coffee, as far as I know, do not cause kidney damage. And there has been some literature in the past that maybe coffee increases the risk of bladder cancer, but that has not been proven. Do you have anything to add, Scott?
No, not really, other than just emphasizing for a lot of these things, just using common sense and moderation. So, a cup or two a day is fine. If you find you're drinking 3 pots a day, that's probably not good for anyone.
And you might be bouncing off the walls too, so probably not a good choice. And our next question is, it hurts to press small areas on my body, for example, with a finger on my back, legs and arms, all like hugging tight. Is this related to kidney disease?
I think that's a difficult question to answer. In general, kidney damage doesn't lead to a lot of symptoms that you're describing. Sometimes there might be other types of diseases that can go along and damage the kidney, but it's really, I think it'd be difficult for us to say, especially in your particular case. Sounds a little bit unusual. I'd get that checked out with your kidney doctor or your primary care physician.
Thank you very much. And we've had a few questions about specific medications, which we're not going to comment on today, but what we will do is refer you back to your family physician, your nephrologist, and your pharmacist who can help you with your specific questions as well in more detail. So our next question is, does CKD cause problems with your bladder and frequency of urinating?
So again, it depends upon the cause for your chronic kidney disease. So if the reason you have chronic kidney disease is because you have diabetes, then diabetes can affect how the bladder works. So it's not the chronic kidney disease itself, but the diabetes that's affecting how the bladder works. Frequency of urination is often a bladder issue and not a kidney issue. But having said that, when the kidney is not able to do its jobs as well as it should, one of the first things that happens is that you tend to sometimes pee more often at night than in the daytime. That's not considered frequency, that's considered just getting up at night. So the frequency of urination is normally a bladder issue. Rarely is it a kidney issue unless you have a specific kidney condition called diabetes insipidus, which is very rare. Scott, do you have anything to add to that?
No, just echo that. You know, we have the kidneys that do all the filtering, they get rid of all the toxins that regulate waste, and then you have more of the plumbing, like the tubes and the bladder and such. And it's often the plumbing that can lead to some of the symptoms that were being mentioned there, but not always.
Lydia, you're muted.
Sorry, as my warning came up, you both reminded me that I was muted, so thank you very much. The joys of webinars and live streaming. So we've got our next question about blood pressure. Is 140 okay for seniors?
Well, that's an individual question again. Everybody's blood pressure is unique to them because depending upon all the other things that you may have, all the other morbid conditions that you may have, that does affect what your goal blood pressure would be. So it's a difficult question to answer as a general, but as a general rule, blood pressure for an elderly person of about 140/90 or 150/90 is probably fine. Scott, do you have anything to add, given that you talked about blood pressure?
No, I was going to say, I mean, you're absolutely right, Joanne. There's the general guidelines. So, you know, I think the most recent hypertension guidelines, which we're not involved with, this is for the general population, not specific for kidney disease, would suggest that 130/80 is a good blood pressure, but, you know, you might accept up to 140/90. But there might be specific individual circumstances that your family doctor has determined that might lead to modification of those.
Okay, thank you very much. We had some pre-submitted questions that I'm going to move to now. And one of those I'd like to have a better understanding of how to read my results and numbers. Can you give me some tips on this?
So that's a really good question, because one of the things we emphasize to people who have chronic kidney disease is that it's good to know your numbers. So I'd like to refer you to the BC Renal Agency website. They have something called Get to Know Your Kidney Lab Work, an information sheet for adult patients, which explains about the tests and the approximate and normal values in Canada and what the test really means. So I would encourage you to go to BC Renal Agency website and just in their search box say lab work or kidney lab work information sheet, and it will come up.
Thank you very much. What are considered acceptable levels of creatinine and protein?
I don't think there's a single answer to that. When I see a patient, I look at, well, how much damage is done to their kidney, which kind of gives me, you know, is it mild or moderate, severe? If they're more at the severe levels, we might be looking at other issues like blood pressure issues or the anemia issues or disorders of potassium or calcium and phosphate. And the second thing I look at is what their progression is. So is their kidney function getting worse over time? So for example, if you have moderate kidney disease, but it's staying stable, that might be less worrisome than someone who has maybe only a slight worsening of the kidney function, but it looks like it's getting worse a lot quicker. Also, Joanne noted that that heat map diagram showing that your risk of developing complications, including kidney failure, is worse at higher levels of protein in your urine. So the normal level of protein is 0. Some people can have a little bit, we get a little bit worried. Some people can have a lot, and that's worse, and we kind of do things to mitigate it or try to control it. But it also depends on how long you have those high levels of protein in your urine. So I haven't really given you a straight answer, but looking at kind of those absolute numbers and maybe using the BC Renal Agency interpretation of those tests, but also the trend over time, like what's happening from in the last year compared to this year, can give people a better understanding of what's happening with your kidney function.
Mm-hmm. Absolutely. It's the trend that's more important, I think, than the absolute one single value.
Thank you. And I've had a question about a specific disease state, but I'm sure it could also be fairly generic as well. How often should polycystic kidney disease or PKD patients be completing urinalysis testing?
That depends really upon the degree of your kidney function. So if you have mild disease, current guidelines recommend that you have blood work done maybe once or twice a year, and the blood work or your lab tests would include that urinalysis test. If you have more severe kidney disease, like say stage 4 kidney disease, then our current guidelines are recommending that you have blood work done every 2 to 3 months. Again, it's individualized depending upon what's happening with your other health conditions. So it really, the number of times that you have blood and urine tests done really depend upon where you are with regards to your kidney disease.
Okay, thank you very much. We have another question live. Are sore muscles related to kidney disease? And they say they have this almost always.
Again, without knowing specifics about an individual's underlying conditions, sore muscles sometimes can be related to kidney disease because sore muscles may be related to a high phosphate level, can be related to a high potassium or a low potassium level, can be related to the underlying reason why you have kidney disease. So there are multiple reasons why you may have sore muscles, and it may be totally unrelated to kidney disease as well. So I would encourage you to discuss that with your primary care practitioner, your nurse practitioner, or your nephrologist at your next appointment. Sometimes I also forgot to mention that sometimes some of the medications that we use may cause sore muscles as well. So maybe your medication list needs to be reviewed.
Okay, thank you very much. And I have 2 more questions for the panelists today. And this was pre-submitted, and the person understands that the answers are likely relative to the patient's situation. So if there's a specific resource that you could recommend, that would be helpful. So for someone living with PKD or polycystic kidney disease, what is the average rate of decline in kidney function year over year? Say, for example, someone in their 40s.
It's really variable, and a lot of it depends on what specific types of genetic abnormalities are causing the polycystic kidney disease. Sometimes we get a hint of that by looking at the family history, but it can be quite variable. I don't think there's a single answer to that question, because you might have different people with PKD the same age who may have very different rates of progression due to their underlying disorder.
Okay, thank you. Another question about PKD. How can I determine if my kids will inherit PKD?
That's something that likely requires you discussing it with your specialists, and may include, counseling as well as a genetic assessment.
Mm-hmm.
I'd be hesitant to say a whole lot more. Joanne, I don't know if you have any other comments.
Right.
But,
yeah, that would be it, yeah.
Thank you. And I've had just another question come through, and this might be our last question unless we get some more. Should kidney disease patients be concerned with getting COVID-19? Is it dangerous?
Well, one of the risk factors for more severe disease with COVID-19 is having kidney disease. And so you should practice good hand washing, wearing a mask whenever you're out in the public, social distancing if required. And if you can't social distancing, wearing that mask is so important. And keeping your bubble, so to speak, small is also a good way of decreasing your risk of developing COVID. Lydia, before we leave, I'm actually surprised today that we didn't get questions about mental health. because during this time of COVID, and I'd like to thank the person who asked that question about COVID-19, there might be more stressors in our lives now because of COVID-19, in addition to having chronic kidney disease or other health conditions. And so I would just like to put out to people that every provincial government has mental health supports that are listed on their websites. And so if people need help with mental health supports, they should go to their provincial government website, or they should call the health line at 811 because they can connect them. The health line can connect people to community resources that are around them. Or there's also a really neat website called Wellness Together Canada that really is self-management, helpful for people that have stressors and mental health concerns in this time.
Absolutely, and the Kidney Foundation can also connect people with peers and other mental health resources if they need to as well. So feel free to contact us for more information if you're looking for mental health resources that are specific to your region as well. We can help you with that for sure. Okay, seeing that's the last of the questions, I'd just like to thank our panelists once again for joining us today and answering so many questions and imparting so much great information on this webinar. And what I just would like to finish up with is just a little bit about the Kidney Foundation. We're committed to providing information and educational resources about the kidneys and kidney disease. We invite you to visit our Kidney Community Kitchen for recipes and information and tools to help you manage your diet. Through our regional branch offices, we offer advice and support about accessing services within the healthcare system, assisting people to access other supports in their community, and offering assistance in skills for self-advocacy. We invite you to connect with us if you have any further questions and to speak to someone in your community or to access further educational resources or materials. Janice has put up her email address. She's more than happy to take any of your further questions to guide you in the right direction for these resources. And once again, from me, I'd like to thank you and our panelists again. And over to you, Janice.
So thank you everyone for attending this webinar, The Keys to Kidney Health. When the webinar has ended, your computer will open to a new page requesting that you complete our webinar satisfaction survey. You'll also receive a follow-up email that will include a link to the survey if you would like to complete it later. Your feedback is really important to help us improve our webinar series, so we appreciate if you'll take a few minutes to complete it. You'll also receive a follow-up email within 48 to 72 hours with a link to view the on-demand recording of today's webinar. On behalf of the Kidney Foundation of Canada, thank you for joining us today. Thank you to Dr. Clarenbach and Dr. Koppel, and please stay well and enjoy the rest of your day.